Millions of Americans are suffering from a condition called diabetic peripheral neuropathy. And as a matter of fact, diabetes is an epidemic, and peripheral neuropathy is one of the many complications that are commonly seen in people who have diabetes. The incidence is high enough that after 10 years of having diabetes, 50% of people have the clinical symptoms of peripheral neuropathy. And about a fourth of those people who have symptoms will be in pain. Sometimes it's unbearable. So I have an epidemic of what's happening. The symptoms basically fall into three ranges. One, the feet get numb. You can't feel them. And as you lose sensation, it becomes denser and denser, and over time, they become completely numb so you can't even feel the floor when you walk. That sets you up for injuries to your feet, for infections that follow, and in about 15% of people have diabetes and amputation. Secondly, you don't know where your feet are in space because you can't feel them. So your balance is awkward, and it leads to a lot of falls. And third, some people get pain. And the pain is a burning pain that's a lot worse at night. It can be very severe and incapacitating. Most people have to wear special shoes. They're using canes and walkers, and some people are in wheelchairs. So there's an epidemic of a disease here that's widespread and very incapacitating. It is caused by nerves that don't function right in the feet. And the reason that those nerves don't function right is because there is a lack of blood flow to the feet. The sympathetic nervous system is very overactive in people who have diabetes. And when it is, it causes a constriction of the blood vessels that lead to the nerves of the feet. And that's what causes the lack of ability to feel things, and also a hypersensitivity in some people that causes a severe burning pain, particularly at night. Now, in conventional medicine, we're using drugs to try and treat diabetic neuropathy. But in actuality, we have no treatment at all for the numbness, none for the lack of knowing where your feet are, which is called loss of proprioception. But we do have some drugs that can be used to manage the pain. The problem is a lot of these drugs have side effects and are complicated. And you have to worry about what they're going to do to you because you don't feel like yourself. Drugs like Lyrica and Neurontin are actually anti-epileptic drugs that are used to control the pain. Elavil is an antidepressant that is used. Then there are narcotics, morphine and codeine and non-steroidal anti-inflammatory drugs, etc., etc. Some people are so disabled by the pain that they're even willing to have a surgical procedure to try and destroy the nerves that go to the feet because the pain is unbearable. So there are a lot of shortcomings that we have in people who have diabetic peripheral neuropathy, particularly if you have pain. Now, there's a new treatment that's out that has been around for about 15 years, but it's not yet popular. And a lot of it is because people just don't know about it. There are actually research articles that are published, and I have been responsible for the publication of one article within the last year. And we'll probably be involved in another research article that we've done at a local medical center that's getting funding, it looks like, from the National Institutes of Health. This technology works. I know that because I've treated hundreds of patients who have it, and I've watched their sensation come back to their feet, and I've watched them be able to get rid of the pain, which very often is fairly straightforward in just 3 or 4 treatments of about 15 minutes. It's cost-effective, it's effective itself, and it's easy to administer. All we need to do is get the word out there. But at the moment, the FDA won't allow us to advertise for this, so we don't. But we can tell people what our opinion is, and that's what I'm trying to do with you today. Now, I'd like you to look at a slide here of someone who has diabetic peripheral neuropathy and a lot of pain. And you can see on the left side of the screen that there's a red foot. And the red is a measure of heat, and we're looking at a thermogram, which measures heat and shows the heat patterns in the foot. We know in diabetes that these heat patterns are very abnormal, and they look typically as you see in this slide. Now, in just one treatment, you can see what's happened. The whole pattern has changed. The pattern has changed into what is a far more normal way for the nervous system to regulate blood flow to the foot. So you see these thermal patterns, these thermal bands that are more normal. This is a good result. And it's the kind of thing we see most of the time as long as the disease isn't far advanced. There are times when this doesn't work, but it's in the minority of cases. And there are times when you have to have some ongoing treatment, but it's not infrequent for people to be treated for this one time or for one series of treatments for under a week and to have a remission for months to years. So we have a brilliant approach here that I think it should be brought forward into the mainstream. If you have diabetic peripheral neuropathy, would you rather take drugs that aren't going to help with the numbness anyway? Or would you rather try to shine a light which has these powerful effects? I'd like to refer you to other sections of the website where we talk about photonic stimulation or infrared light therapy, which is what I'm talking about in this particular case here. And so there are many references and stories that you'll want to read about to see how it's used for many different applications and see if it's the right treatment that you want to try. So diabetic peripheral neuropathy has now had great strides. We had enjoyed great strides forward with the advent of infrared light therapy.